What's a stretching program for? What's the purpose? Warm up. Okay, sure. That's a great one. You just want to get loosened up and warmed up in order to get ready to do more physical work. Especially important for truck drivers, right? Because one of the main problems there is static positioning, or being in one position for a long period of time and then having to leap into physical work. Okay, what else? What else can stretching be for? That's how it's traditionally used in the workplace, is simply as a warmer-upper routine.
Make you aware of physical hazards, physical challenges, make you aware of your body before you get into doing the physical.
Sure, and if you know where you're tight, you're going to be a lot more careful. If you notice your back's tight on a given day, it's going to make you a lot more aware if you have to go, lift chains or pick up a tarp or something like that. So that certainly can help. Any of you ever stretched for pain or discomfort? Okay. If you've been in physical therapy before for any sort of problem, you know that a lot of times they'll use combinations of stretching and strengthening exercises with which you can relieve certain symptoms. And that's kind of the approach I take with stretching. And I think it gets people interested in stretching if they think that they can take care of some of the aches and pains that they tend to have in relation to the work that they do on a daily basis. It oftentimes creates a little bit more motivation to learn how to do that. Pain is a great motivator, I find, and people are much more willing to learn when they have something that's either bothering them on a continuous basis or it's interfering with them actually performing their job duties. Okay. So what I want to start with, let's see, I want to make sure that I don't talk too long here, so about halfway through we want to start actually doing the stretches. So Dale, I'm going to put you in charge of cutting me off if I get too long-winded here, and make sure that we get to the activity, because that's the main thing I want to share with you, is we're going to go through the stretching routine that we're going to work with today, and have all of you try it and have me give you some feedback. In fact, let me hand this stuff out now. There should be more than enough. The stretching routine on top is actually the thing we're going to look at last, but you'll figure out what we're doing when I get to the overheads. The routine you're looking at is actually one that I developed for Sherman Brothers, minus their logo, it's a training that I put together specifically so that the truck drivers have something in their hand in the cab that they could look at and refer to, and hopefully start using some of those on an as-needed basis. All right. With a stretching program, what are some of the things that make it successful? If somebody's going to set up a stretching program on the job, what are some of the things that make that successful? Well, sure, but I mean, how do you actually get them to use it in the first place? Teach it. Okay, so some kind of training where they actually get some, handing them a sheet of paper is one way to do a stretching program. All right, probably the lowest rate of success as far as that goes. All right, doing a training of some sort where they're actually being taught by somebody who knows how to stretch properly is the better way to do that, where they're actually getting some information, having a chance to try it with some supervision, with some instruction. Okay, another thing that has to do with successful stretching programs, that generally if the people get together as a group in the morning, all right, and stretch together, that's one of the key factors. All right, not going to happen in truck driving, is it? Okay. Let's see, what else?
I think time is a big issue. Typically when you say stretching, sometimes folks think they need to do 20 minutes of stretching. 20 minutes of stretching. So the stretches need to be specific a lot of times, which is a lot of what I do also, is trying to key the stretches towards the areas where people are actually having problems in relation to the work that they do. Okay? So, as we think about that, some of the challenges about having truck drivers stretch, it doesn't fit in well with the traditional model of what's worked well for industry in general. So they're really going to be on an individual basis of deciding whether they do the stretches or not, which stretches they do, and how they stretch. So I think education or training is really the key. All right. Let's go ahead and jump in with talking about muscles and how they function, and then we'll talk a little bit about how they tend to dysfunction in relation to the challenges of driving. Okay, so biceps is a good, can you all see that from way back there? Can you all read that? No. Can you really? Oh, okay. I'll read it for you. All right, but that's a good example of a typical muscle, is the biceps muscle there, where you've got sort of a thicker
muscle in the middle. It tapers down on either end to where the outer covering of the muscle becomes the tendon. The tendon connects to the bone, right? And then the tendon on the forearm, and then the tendon connects up on the shoulder. So that when the muscle contracts or shortens, that creates a leverage or a force on the bone that allows you to move your arm. And then when you relax that muscle or tighten the muscle in the back, then it drops back down. All right, so muscle contraction, muscle's contractile, it shortens, it lengthens. That's how we move our bodies and do the things that we do throughout the day, whether it's walking or driving or wiggling your ears or whatever it might be. It's all basically muscle contraction in one form or another. If we break that down into its components, all right, then we take that little segment out of the muscle there, take it to there, and as you break it down into smaller and smaller components, you can see that it's a series of sort of smaller and smaller bundles of cables, all right, until eventually you get down to the microscopic level where we're dealing with molecules, where ultimately what you get is these actin and myosin filaments put together in what are called sarcomeres, or functional muscle units, all right, and they sort of orient themselves like this, where there's an overlap, so that when your brain says reach down and pick up that cup of coffee, all right, those fibers slide over the top of each other so that a muscle segment that was this long becomes this long. All right, that's how your muscles shorten. There's millions and millions of these segments shortening, all right, creates a shortening of the muscle and a movement of the body. All right, the more force that's needed to do a particular movement, the more muscle segments are recruited to generate that force. Okay, so not many for a cup of coffee. If you're lifting a 40-pound dumbbell for a bicep curl, you're obviously going to need to recruit most or all of those segments. All right. So what happens to the muscles of drivers? One of the things that I like to think about as I look at somebody in the work that they do is note how their body tends to shape in terms of their soft tissue to their regular position or the repetitive movements that they do. All right. If we're talking about a driver, what's that going to look like? Okay, seated position most of the time, right? Vast majority of the time they're going to be in a seated position, so I'm going to look at hamstrings probably being tight. I'm going to look at hip flexors probably being tight. All right, those are two key factors because both have a large impact on how the lower back functions. Right? So obviously there's going to be some emphasis on looking at hamstrings. A lot of times drivers will tend to have their hands on the wheel or on the stick shift, which means their arms are out in front of them. Generally you're going to see more tightness in the chest, front of the shoulders. They tend to pull the shoulders forward. All right, also with drivers, because they're looking out away from them, unless they're really conscious about sitting up and using the headrest, the head will also tend to be out in front, which tends to put more pressure on the front of the neck muscles. Those will shorten and create sort of an imbalance between front and back. All right, so when I'm looking at a job and I'm looking at developing a stretching program, what I'm looking for is where the imbalance is being created and how can you use stretches to eliminate that imbalance or minimize that imbalance. All right, and a lot of times it's as simple as looking at where their body's getting pulled or positioned and doing things that reverse that. Okay, and you'll see what I mean when we actually get to the stretching routine. All right, so if you're looking at somebody who sits all day, those hip flexors aren't just going to get tight over time if they're sitting and they're not stretching them out, especially if they're getting to a certain age. They're actually going to shorten so that those muscles in the hip flexors, those muscles in the hamstrings are not just going to be short until they get up and move around. They're going to tend to stay short. Right? A shortened muscle creates increased pressure on the tendons. Increased pressure on the tendons will create increased pressure on joints. All right? When you get to the point where muscles are imbalanced enough to where you're getting pressure on the joints, that's where you're increasing your likelihood of soft tissue injury, all right? Or MSD injury, a term I'm sure you're all familiar with, musculoskeletal disorders or musculoskeletal injury. Okay? Does that make sense? All right. Now, with truck driving, it's more of a problem of static positioning and then leaping into activity. But repetitive type movements will also do the same kind of thing. All right, for those of you that are working in other areas where there's more of a manufacturing approach, you see the same sorts of things. The muscles that are used on a regular basis through a particular range of motion will gradually shorten either in reaction to that or to accommodate that. All right. So when I'm looking at a muscle and trying to stretch, I'm looking at muscles that are actually shortened. They're not just tight. I see that as a key difference. Okay. And when we talk about stretching technique, we're going to talk about how do you get those muscles not just to stretch but to lengthen. Okay. You lengthen the muscle, you decrease the pressure on the tendons, decreasing chance of tendinitis. You decrease pressure on the joints, decreasing chance of joint injury. We'll talk about that in a little bit more detail. Any questions on muscle function and muscle dysfunction. So far, so good. We can come back to this if we need to. Let's talk about some risk factors. So from what I gather from Dale, is one of the things that we're dealing with mainly with flatbed drivers is back injuries. Is that correct? We're seeing more lower back injuries than anything else? Back and shoulder. And some knee. Okay. All right, so if we look at risk factors for musculoskeletal disorders or soft tissue injuries, and by MSDs I'm including lots of different things. The classic sprain strain injuries, which I'm sure you're all familiar with. We're talking about disc injuries fall into that category. We're talking about rotator cuff problems, which I'm sure are most of the shoulder problems that you're seeing. Cartilage, ligament problems in the knees. The compressive problems, carpal tunnel at the wrist. All right, compressive problems at the elbow, compressive problems at the shoulder, where changes in alignment or muscle tension are creating pressure on nerves or blood vessels. All right, so those all kind of fall into that category. The itises, tendinitis, bursitis, tenosynovitis, right, all kind of fall into that MSD category. All right, I'm the stretching guy, so of course poor flexibility is going to be at the top of my MSD injury risk factors list, right? And that should be in your stack of handouts there, as I made copies of all my overheads so you can follow along if you like. All right, so poor flexibility obviously is going to lead most often to sprain strain type injuries, right? You got somebody with a tight back. They've been sitting for 3 or 4 hours. They go to lift a tarp. Guess what? The muscles aren't ready to work. The muscles are going to give. All right. My definition of an injury is when the load placed upon the body exceeds its capacity to absorb it. All right. So you can either do two things to prevent that from happening. If you know you're kind of getting to the edge of what your body can handle, you can either decrease the workload, all right, make a lighter tarp, put it on with a forklift. Something like that, or you can increase the capacity of the body to handle the workload. If it's something that absolutely is going to have to be done no matter what, then you've got to find a meeting point somewhere between those two. All right. Poor flexibility often leads to poor body mechanics. All right. And I'm sure this is a factor in some of the back injuries and shoulder injuries that you're seeing. Is poor alignment will often increase the chance of an injury. All right. Poor joint alignment makes that joint susceptible to injury. It makes it weaker. All right? Good joint, a joint that's aligned well with good balanced muscles around it, it's pretty difficult to injure it, all right, with a normal workload. Right. One of the things I see also is that poor flexibility often leads to poor body mechanics. We were talking about hamstring flexibility. I'll see this a lot in body mechanics trainings where, a lot of what I'll focus on is being able to maintain a neutral position while bending the knees. That's sort of a basic skill, but a lot of people can't do it. And a lot of times it's primarily because the butt muscles, the hamstrings, lower back muscles are so tight that as soon as they start to bend their knees, their butt will tuck under. Right? And even if you're bending your knees, it's going to take some of the pressure off your back, but a lift from here is still probably going to be 60-70% back muscle and ligament lift. Right? That's where the pressure is going to go, as opposed to being able to keep the rear end out, drop it behind, and maintain a neutral spine position. Okay? And you'd be surprised how many people simply physically cannot do that because of hamstring, calf, butt, lower back tightness. All right? It's a mechanical restriction that they just have to work on until they can get past that point, and then you maintain good alignment in the back, which kind of leads to everything else. That's a whole other training. Okay? Age. Is this a factor for any of your drivers? Okay? At what point, at what age do people start losing their natural flexibility? Anybody know? There's kind of a range, but when? About 3? There are special circumstances, yeah. Generally people notice that you don't have to do a whole lot in your 20s to maintain flexibility. Once you get into your 30s to mid-30s, people are usually noticing that if they're not doing something on a regular basis to maintain flexibility, meaning stretching, lifting weights, some sort of cardiovascular exercise, that they're generally going to lose flexibility over time. All right? It's just sort of a fact of aging. One of the other things that happens is you'll generally lose some ability to heal. All right? So restorative abilities of the muscles and the soft tissue diminish as you get older, so that things that sprains and strains that used to heal up in a couple of days, maybe they take a week or a week and a half now or longer. All right? I'm sure some of you have some personal experience with that as well. Let's see, I'll be turning 40 next month, so I now know that all my stuff that was just theory 5 years ago, now I know from personal experience that yes, it is actually true. Okay? Highly repetitive work, Heavy and repetitive work combined are two key factors. More important with trucking is that static position that I was talking about, right, where you're locked in one position for long periods of time without moving around. In addition to that, you add vibration, all right, and that creates extra opportunity for the body to tighten up, right, and for muscles to shorten. Okay, this probably doesn't apply either, but not enough rest or sleep. Okay? Why is that an issue in terms of increased risk of soft tissue injury, either in the shoulder or the back? What's your body doing when you sleep? Resting, repairing, regenerating, remaking muscle energy storage. So if you're not getting that, then the body tends to be sort of constantly running on empty. Muscles don't function as well. Increased likelihood of sprain, strain type problems. Poor cardiovascular conditioning, again, kind of goes hand in hand with the lifestyle, right? I'm sure some of the drivers probably get out and walk on a regular basis when they get a chance, but mostly it's in the seat is where they're what they need to do is find a driver's seat that has a stationary bike attached to it, and that would solve a lot of problems, right? Yeah, I don't know, might be a little dangerous. That's right. I think you're onto something here. Ergonomic workstation design, boy, I see most of the trucks have pretty good seats and pretty good design these days. Most of those seats are pretty adjustable. Is that? I mean, I'm sure people have kind of made that a priority as the years have gone by, and good air seats and good cushioning and good vibration absorption. So that's not as much of an issue with drivers as I think maybe it was in the past. But always something that you can look at, and other tasks involved in what they do certainly can benefit from ergonomic attention. Tobacco or caffeine use. What are both these substances? Besides heavily used by drivers. Stimulants, right? What do stimulants do to muscles? They make them tighten, all right? They make them tense up. They also tend to dehydrate, okay, which is another factor. You're much more likely to have soft tissue type injuries if you're dehydrated than if you're fully hydrated. All right? Poor diet, again, probably not a factor here, but we bring it up anyway just in case that might be a factor. All right? Any questions on those? Benefits of stretching. Okay, so first 4 or 5 kind of go hand in hand. Reduce pain, stiffness, achiness in muscles and joints. All right? As I said before, that's what I really like people to think of, is it's not just warming up. Drivers in particular may be much more open to the idea of using their stretches to deal with some of the aches and pains that come with the job. I know they have them. Most of them probably rely on Advil. A lot of them would probably like to have some other skills that would help them deal with that. Right? And this is something that you can certainly do that way. Improved circulation kind of goes hand in hand with reduced pain. One of the problems with muscles that are tightening and shortening is they tend to squeeze off their own blood supply, so you see decreased circulation to the muscle tissue. Again, makes it less healthy, less functional, more prone to injury. Okay? Improved flexibility or range of motion in the joints. So if you loosen up the muscles around a shoulder joint, a shoulder that used to stop here or here, now has full range of motion. Obviously, that has some implications if somebody's having to do overhead work. All right? Reduced risk of soft tissue strain. We already talked about that. Reduced risk of joint injury. For example, shoulder, lower back, knee, or wrist. So somebody tell me how stretching muscles around joints reduces the risk of joint injury. What's that? Better circulation. Sure, that's going to help. All right. Anybody else? Reduce tension on the joint. Yeah, I kind of mentioned that a little bit before. So, again, I tend to think of things in terms of balance systems. So if we look at a knee joint's a pretty simple hinge joint for the most part. You've got the quadriceps on the top, all right, which give you extension at the knee. You've got hamstrings and calves in the back that give you flexion at the knee. All right, and there's some rotational abilities, but those are the main movers and the main stabilizers of the knee joint. Any significant difference between the strength of the hamstrings and the strength of the quadriceps puts a oblique pressure on the knee joint that increases the likelihood that it's going to have a problem. All right, the forces will be transferred through the knee joint differently if the muscles are out of balance than if they are in balance. Does that make sense? Okay, same thing with flexibility. If your hamstrings are really tight, all right, and your quadriceps are normal, again, that can put a pressure on the knee joint or a load that creates an uneven force that increases the likelihood of injury. All right, let's see. Decreased pain means decreased distraction and therefore reduced chance of safety behavior lapse. Who'd like to translate that into English for me? Or at least put it in a nutshell? What am I talking about there?
Prevent injuries and be more productive.
Right. Well, you know, I mean, I've always thought I haven't figured out a way to prove it yet, but in manufacturing in particular, and I think a lot of other areas, you can trace back injuries in a lot of cases to a mistake along the decision chain, right? It's not necessarily environmental factors. And, yeah.
Yeah, if your mind is on something that's hurting you, and you're not focusing on driving or whatever else it is that you should be.
More likely to make a mistake in the sequence of things that you might normally do properly if you had your full attention on it. Yeah, that's kind of the idea. So again, I haven't figured out a way to prove that, but it sure makes sense to me that if you've got somebody who's having to work with pain, their back's killing them, their shoulders bothering them, their feet are aching, they're going to be thinking at least a certain amount of their percentage is going to be focused on that. All right? So it makes sense that, again, if people can figure out ways to reduce their pain, it may reduce the chance of other types of injuries as well. All right? Somebody figures out a way to prove that, please let me know. Improved ability to relax and improve sleep. A lot of times just getting your muscles looser, more relaxed, people are going to tend to be more comfortable. They'll sleep better. The sleep will tend to be more restorative. All right? People who toss and turn a lot often have very tight muscles and have a hard time getting comfortable, and that leads to poor sleep, which leads to other problems. Okay? And if done properly, here's the surprising part, stretches should actually feel good. All right? Whereas for a lot of people out there, stretching falls into the no pain, no gain category, right? If you're not killing yourself with them, how can you possibly be doing yourself any good? And from my standpoint, that's actually the furthest from the truth. All right? The way I have people do their stretches, and we'll talk about this coming up next, is very, very gently, very, very minimally, and the key is convincing them that they can actually get a benefit, and in fact a better benefit, by doing it that way as opposed to horsing on the muscle and trying to get it to stretch through a matter of maximum force or maximum effort. All right? Any questions here?
Yeah, how long does the stretch really last?
How long can a stretch last?
Yeah.
Depends on who you talk to. What I use as sort of a baseline is about a 40 to 45 second minimum when I'm dealing with somebody with a specific injury. For a lot of the stretching routines, because of time constraints, I'll say 30 seconds to 40 seconds. I don't think that's really enough to really stretch out a muscle that's being dysfunctional. But for a lot of people, if it's more of a warmer-up routine or a get-ready-to-move routine, then that's going to be enough.
I think what Gerald was asking is if you stretch in the morning, how long will you get that benefit during the day? Do you need to stretch halfway through the day?
Depends on how you do the stretch. Okay, and it depends on what you're doing in between as well. All right, so stretching instructions, and you can see I made these specifically for drivers. So we start with instruction number 1, which is do not do your stretches while driving. All right? I thought about that when I first did that routine for Sherman Brothers, and I thought, do I really need to include that? And I said, yeah, I probably do. And I think that's probably true. If you didn't, they'd do it, right? Yeah, I ran out of room. Yeah. So here's the key. Don't think of your stretches as exercise. You want to think of them as relaxation techniques. All right? You're not. What a lot of people do is they think they've got like a piece of inner tube in their hands where you got to grab one end here, one end here. The more force you apply to that inner tube, the further it stretches, right? Okay? So why does that not work with muscle tissue? Because it's not just elastic, right? There's a contractile ability, and when you get to a certain point, that muscle is actually going to start contracting or fighting what you're doing. Right? And for most people, when they stretch, they go at that point or beyond that point. And so they'll feel a really strong stretch, but what they're really feeling is a combination of them pushing the muscle pulling back. All right? It feels good for about 5 or 10 minutes, but oftentimes after a vigorous, more forceful stretch like that, the muscle will just tighten right back up again, and it'll feel similar to what it did before. Okay? So Again, what we want to think about is not physically forcing those muscles to a longer length, but triggering a natural relaxation effect in the muscle. All right? So the way you do that is by stretching gently at the edge of where the muscle wants to go and waiting for it to relax on its own. Stretching is much more of a patience game than it is an effort game. All right? You have to put it at the right position, and you have to wait for it to let go. All right? Got a lot of patient drivers out there, do you? It's a good skill to learn. All right? So, move slowly. Let's go through the instructions. Move slowly into the stretch until you feel tension or pull in the target or shaded area and stop there. You're looking for a bare minimum of stretch. This is the difficult thing. 98% of the people out there will go well past that point. So what I generally have people do when I'm teaching them to stretch is, for example, on a simple forearm flexor stretch, they'll be bringing their hand back, keeping the elbow straight until they feel the stretch up into this area, okay, of the forearm. Some people will feel it down lower. All right, and then what I usually have them do is once they get to what their brain says is a good stretch point is I have them back up. So in tiny increments, they back their way out of the stretch and stop at the place where the stretch disappears completely. All right, and then from there you go in just slightly. So what you want to do is you want to find that knife edge of where the stretch starts and where it stops, and then go just slightly past that point. Okay, and we'll get a chance to do all this, so you'll see if I know what I'm talking about or not. Some of you may actually feel what I'm talking about today. Sometimes it takes a couple of times of doing the stretches before it really has that effect. Okay, so ideally what's going to happen is once you find that minimal stretch position, you're going to hold it. Physiologically, it takes about 15 to 20 seconds for a muscle to start to let go or start to relax on its own. Okay? The problem with that is most people stretching on their own will hold their stretches anywhere between 5 and 15 seconds, and usually not a whole lot longer than that unless they've been specifically trained. Okay? So ideally what's going to happen is after about 15 to 20, 25 seconds, you're going to feel that ease up or release, or you'll just notice that you don't feel stretch at that angle anymore. Then you go ahead and take it further and take up the slack in the muscle that's being created. That means the muscle is lengthened, right? Take up the slack in the muscle, find the edge of stretch, and hold it again. Okay, so during a 30 to 40 second stretch, you may get 2 or 3 release points where the muscle lets go, you take it further, the muscle lets go, you take it further, lets go, you take it further. So you're getting a lengthening effect in the muscle rather than forcing past where the stretch wants to go or where the muscle wants to go and expecting it to release all at once. Especially if it's an area that's chronically tight or there's an injury in that area, it's not going to let go. All right? How many of you have been to the doctor before where they hit your knee tendon? Okay, what happens? Reflexive contraction of the quadriceps, right? How come? Okay. They're testing your reflexes there, but what they're really doing is they're triggering a pressure sensor in the tendon. All your tendons have pressure sensors that let your body know when they're getting overloaded. So when that mallet hits that sensor, it sends a message to the brain. The brain gets a sense that that tendon is being overloaded, sends a muscle back to the quadriceps that says protect that tendon. So that's all that is that's your body protecting that tendon from the perceived overload. Okay? All your muscles have that same mechanism. They all have that same pressure sensor, so when that tendon or that muscle gets overloaded, the brain's going to send a message that gets it to contract against that to protect it. Okay? Which is where you get muscle pulls, right? You're pulling the muscle one way, the body's pulling it against it, something's got to give if enough force is loaded on. Okay, so what we want to do is we want to trigger the relaxation effect and not trigger that protection response. And it's a fairly delicate dance for some people if they're particularly tight, and it takes a while to learn. Okay? If you feel pain on the stretch, obviously you've gone too far, in fact, way too far. The first thing to do is ease up on the stretch. Okay? So like I showed you, back out of it, find the minimal stretch position, hold it there. Occasionally people will want to sort of adjust the angle a little bit. If this is a nice, easy stretch, but it's pinching in my wrist, then I may want to rotate this way, might want to rotate that way. So you first ease up on the pressure, then you change the angle if you need to. Okay? Find a stretch that feels good. If it doesn't feel good, you shouldn't be doing it. I can't stress that enough in my trainings, and I often do at least 10 or 15 times. Okay? I'll say it again to you guys. All right? The stretch has to feel good. If it doesn't, you need to change something. If you can't find a way to make it feel good, it's a stretch you shouldn't be doing at that particular time or maybe ever. Okay? Relax, focus, hold the stretch for about 40 to 45 seconds. Again, that can vary. For some people, they may hold it as long as 60. All right? Depends on how the muscle reacts, depends on how tight the area is. Certain muscle groups need longer stretches. Hamstrings in particular seem to take longer. Lower back muscles sometimes will bigger, thicker muscles will sometimes take a little bit longer to release and lengthen. Okay? Let's see, I think we covered that. Bouncing, I think everybody out there knows that bouncing isn't good, all right, on the stretches, meaning this kind of thing. And if you think about what we talked about with that pressure sensor, most likely what you're going to do when you do a bouncing type stretch, this kind of thing, is what you're going to do is you're going to trigger that protection response in the muscle, and it may feel good temporarily, but it's probably just going to tighten up when you get done. Don't hurry. A lot of times when people have a stretching routine, they're trying to rush through it. If they're short on time, I'd rather have people do every other one and do them properly rather than rush through all of them and do them sort of halfway. Okay. Did I say this yet? Remember, your stretches should feel good while you're doing them. Okay. I just wanted to make sure I covered that. Okay. They should feel good while you're doing them, and they should feel good after you're doing them. On occasion, I'll have somebody who does a stretch, and they've got good form, they've got good amount of tension, it looks good, they actually get a release, but as soon as they let go of it, the muscle starts to tighten up. What's that mean? Still a little bit of an overstretch. It's a negative reaction to the stretch, which means the muscle is contracting against what you just did. So even though it felt good at the time and it seemed to be a good stretch, still just a little bit of overstretch. It means you're very close, but it's not quite there. You need to go easier. Any negative reaction, generally 9 times out of 10, you need to go easier on it. Sometimes you need to change the angle.